Sure. So, my name is Athena, and I have HS. And I had received a couple of emails from the institution where I was receiving care. They had these support group meetings, and they were in person. And at first, I was actually a little hesitant to attend. I don't think I went to the first couple of them. I was just unsure of what to expect, and I was really uncomfortable talking about my HS. And so I just didn't, I was a little afraid almost to go. And so my late husband was super supportive and encouraging, and he said, just go to one. Try it, see if you like it. If you don't like it, you don't ever have to go back. But just go to one because you don't have many places to talk about this. So I went, and I was instantly hooked, to the point now where I'm president of the organization that runs them. And what had me hooked was this immediate connection with patients. So I'd only ever talked about it with my husband, with a doctor, and with a few close friends and family members, and they could understand me and hear me. I was really fortunate to have this great support system, but they didn't have it, right? So I never was able to connect with somebody about this disease on a real one-to-one level. And I walked in this room, and all of a sudden, it was this safe place to have this disease. People really understood each other. We were really connecting with each other. We were helping each other and just kind of giving each other advice on how to cope. They're led by medical professionals, so all of our chapters have a dermatology specialist that runs them. And so they were also a great source of information because up until recently, Google has not been very kind to this disease, and it's hard getting an accurate source of information, and it's hard going to a place without having to question whether or not you were just being pandered to for a product, right? So back in my day, they had this digital download that you could buy. It was HS Cure. You could download it for $39.95. It's just, the sources were not good, and they were scarce, and they were a little frightening. So going to this place where I could really connect with patients and have a knowledgeable, incredible source of information to ask general questions about the disease, it just became the highlight of my month. I mean, we met every other month, but I was at every one unless there was, extreme emergence. But yeah. Sure. So I am very blessed to have a talented board of directors, and we all have our responsibilities and our tasks that we do, right? So I have an amazing secretary and a treasurer who's great with finances, and we have someone who does social media and another one that works with fundraising. And so together as a group, we work great. And so my job as president, my primary responsibilities are to help new chapters launch, to really facilitate, and also to be there for the board of directors in the help that they need. So when our secretary, who's currently designing our website, says, I really could use a hand with this, or with our director of social media needs feedback on something, I tend to support them as well. My primary responsibility, other than being, the president, is really the chapter development. I'm the contact for all of the chapters. So any media that they need, things that will help them with their support groups, that's a lot of what I do. So I think it's amazing the connections that we have been able to establish with the patients. And we have created this amazing, safe place where our people that attend these meetings know that they're going to go there and they're going to leave feeling emotionally connected somehow. One of my fondest and most profound memories with these support groups was about a year ago. Birmingham, Alabama launched their chapter, right? And so our meetings are virtual. Anyone can attend. So if you are in Australia and want to attend Birmingham, Alabama's chapter, you're more than welcome to attend. but the chapter was led by Dr. Tiffany Mayo. She's an HS specialist, and she'd promoted it within her clinic. So it ended up just being a lot of people from Birmingham, Alabama, but none of them knew each other. And so I always go to the first meeting just to help facilitate any quiet spots if the team is, unsure of. Really, we prep them as much as we can, but ultimately it's kind of like a safe place or a safe guidance if I'm there to help make sure everything runs smoothly. And so 5 minutes into this meeting, in this room full of people, the Zoom room full of people that had never met before, Tiffany and I sat back, and they were all talking to each other like they were best friends and really giving each other supporting words of encouragement, advice, and really just kind of bonding together as a group. And they had never met each other before. So I think it speaks a lot to how much patients need this connection. And every single meeting. I am also the chapter lead the community lead for the Hershey chapter. So Dr. Jocelyn Kirby and I work together in the Hershey meetings. And at almost every meeting, I end up crying. This is often the first time that they can fully vocalize having their disease and in a place that they feel safe. And so it's very evocative of emotion, right? Like they've never been able to put words to this, and now they feel safe to do that. And these stories are heart-wrenching. And so while I won't go into detail because I'm very, protective of what happens in those meetings, it is a constant reminder of how much patients need these safe places to just be with this disease. So I think there is a lot of hesitancy in terms of medication for HS. First of all, there's not a lot on the market and available to us. I'm not sure exactly what the climate is like in Australia, but here in the US, we have one FDA-approved medication, and it looks like this summer we're going to have our second. And they are both biologics, and there's a lot of misunderstanding about what biologics are, how they work, and the side effects. And this again might be different in Australia, but when you are trying to advertise for a drug in the United States, they have to end the commercials with side effects. It's like a mandatory statements that they have to do. And so patients will hear these side effects and get really scared of what those can. So I think there's hesitancy because there's not enough, they're not quite hitting the message, right? Personally, I have no problem taking medicine for this, but I've never had that hesitancy barrier. There are a lot of patients who hear, I could develop cancer from these treatments, and that really scares me because I can live with HS, but cancer might kill me. And so there's this hesitancy and this mistrust with the medications because they haven't really been around. And then we've also been to numerous doctors along the way until we get to an accurate doctor. And we've had traumatic experiences with these doctors and the diagnoses. So it's a lot of mistrust, both within the realm of medicine, but also within the realm of doctors, because we've been told, on those multiple visits and those misdiagnoses to getting an accurate HS diagnosis, we've been told we're dirty. We've been blamed for being overweight and for being smokers and just, it's things that we're doing that causes this. It's something wrong with us. And so we've had so many bad experiences with doctors that to finally get one that wants to help, it just takes a while to build that trust. Does that make sense? So aside from the first one is always going to be pain. It is, when I talk about crippling pain with HS, it is crippling pain. It is, I can't lift my arm to brush my hair. My late husband had to help me put t-shirts on and clothing on before because there were times I couldn't bend over or lift my arms to get clothing on. Showers were difficult. Everything. When you are in the midst of a flare, it is all life consuming. You can't even sleep comfortably to get the rest that your body needs to work with this. And then on top of it, you're hiding it from the rest of the world because there's so much stigma. Don't even get me started with that. And then there are other challenges, right? So HS occurs in areas that are unfortunately super difficult to bandage. It's hard. We've come a long way since then. There are some amazing products and amazing tapes. But when I first started in this and when I first had this disease, I went to visit a friend once in New York and traveled with a roll of paper towels and just kept paper towels in my arm and held it by tension. And there are patients out there who don't have this community yet and who don't know what they have and haven't been able to talk to other patients that don't know how to manage that either, right? When you are constantly draining in between your inner thighs and you have to sit down somewhere, that's a really difficult place to bandage. So it is all consuming when it comes to quality of life. So in the US, at least, we've got some great things in the pipeline. First of all, surgery has come a really long way, and I always talk to patients about that. I was never one for surgery. In the years coming up, I was like, this could be, I'm so sorry, my phone just, in the year, the statistics were not that great. In other words, you would go through this whole process where you were in the hospital and then, with wound vacs and just massive holes cut out of you and no guarantee that it wouldn't come back. But HS surgery has advanced so much. So I went a long period of time without having access to an HS specialist. And when I finally got back to one, the argument that my dermatologist made to me was, the scarring is never going to undo itself. Like, we need to do surgery and we need to do medicine, but ultimately this is never going to undo itself. And I had told her at the time I was newly widowed, and so I lived at home by myself, and I was super concerned about aftercare with surgery. So she actually did the procedure in her office. I was awake the whole time, and she did a staged excision. So she would go in and take some of it out. It would heal, and then we would go in and take more of it out, and we would do it in steps and procedures. The healing process was super easy. It took a little bit longer, but we did something called healing by secondary intention. And so that's where there's no stitches, there's no wound grafts, you're not in a hospital. It's left to heal from the inside out. And so you basically live with Vaseline and 4x4s and tape. And it heals from the inside out, and it develops the scar tissue so that the HS can't come back. I've had quite a few of these surgeries, and I've trusted my dermatologist every step of the way with it. So surgery is great, right? Dermatologists now are also doing smaller procedures called deroofings. So when something doesn't get quite as bad and you don't need to do a larger area like an incision, you literally take the top of it off or the roof of it off. And these are procedures that can prevent something from, creating a massive procedure where you would need an excision. And so you can go in for smaller procedures now, as opposed to having to wait for it to get even bigger, and you have to have a whole area excised. So surgery is really exciting in terms of advancement. And then, like I said, in the U.S., we have one FDA-approved medicine. We've got another on the way, and then there are several in clinical trials. And that's really exciting because we're going to have options. So the first one that is FDA-approved doesn't necessarily work for everyone. And so I get really excited when I think about, I actually failed Humira. I was on it. I was actually on the clinical trials for it. And then I went off of it because I was trying to get pregnant, and there wasn't enough known about it back then. And then I went back on it, and I had developed an immunity to it. And so Humira doesn't work for me. And so I'm super excited about this next biologic that's coming out, because it may. And if it doesn't, then I know that there are other drugs in stage 2 and stage 3 that are in the pipeline. So there's a lot to be excited about in the world of HS in terms of treatment. Primarily, I would like to see HS be treated as a whole disease that has, with all of its comorbidities, considered and taken into consideration. So when a patient goes in looking at this disease holistically and understanding that there are a number of comorbidities that the patient may be facing, depression and anxiety being the top ones, I think mental health is really important, and it is certainly impactful. So just having physicians be mindful and making sure that that it's okay for patients to be seeking mental health help for this disease because of how much it impacts us. But then also, we're prone to anemia. There are numerous comorbidities, and having dermatologists have a plan, or at least educating patients about this and consulting with their primary care to make sure that their overall health is good. So the first thing I would say is get to a dermatologist or a knowledgeable provider that can give you options. One that's going to get incredibly creative with you and make sure that you are being treated. So if one option doesn't work, then they'll have an armory of tools to work with you. One that you feel comfortable with, one that you feel really relaxed about going into, and one that is going to be fighting. And if you don't ever feel like that, seek out others, because there are some really amazing dermatologists in this world. And so if you have a bad experience with one, or you're not super comfortable with one, don't stop looking for another, because they're out there and they have heard the stories, they've heard us, and they are wanting to treat us. So it's hard to find, but they're out there and they are amazing once you get there. And then also for families, just being supportive, asking us if we are okay. We are, by nature, just so used to dealing with this by ourselves that it's hard to ask for help, and I always tend to forget to do it. So when my friends and family are like, do you need help? I'm like, I've been doing this, by myself for how long? But it's still nice to be asked and to have these needs acknowledged, because it's been so minimized for so long. So having it just acknowledged in the spaces that we're at is super helpful. But also connecting to the community is really important, because HS patients are amazing. The other advocate from HS Connect, Brinley, she's the president and co-founder. She's become a really dear friend of mine. And it's because we both know and understand what it's like to live with this disease. And we both know and understand what it's like to talk to other patients who are going through this. And every advocate that I've met for HS and every patient that I've met, they're so incredibly kind and beautiful and just warm and welcoming to each other, because we can really connect with having this disease, and we know how hard it is. So the HS community is a very underserved population of patients, but it's estimated that 1 to 3% of the population has this disease, and they have a lot of unmet needs. I would work with talking to the patient community about their unmet needs and about how much help they need, but I would also rely on the amazing experts that you have in your country who are dedicating their careers to studying this disease and advancing the knowledge of it.